Sleeping is a time for our bodies to heal, grow, and repair. Quality and adequate sleep is such an important part to your recovery. However, when you're in back pain, it can sometimes be difficult to find that right position. I'm Dr. Laubach from Back to Health. Join me in this video as we review some tips and tricks to help you find a comfortable position to get some better rest this evening. Let's take a look. So I have my lovely assistant Madison here with me, and we're going to be going over some tips and tricks to hopefully help you guys get a little more comfortable and sleep better when you're suffering with lower back pain. The first question I get asked is, what is the best position to sleep in for my back pain? And the answer to that is whatever position offers you the highest amount of relief. I'm going to show you some tips and tricks today, and hopefully they do help you and alleviate some of your discomfort. But if something that you're doing gives you relief, or a position that you're laying in gives you relief, do that. Certainly let me know too, maybe we'll add it into this video. But one of the things I'm going to be using is a variety of different wedges, bolsters, and pillows. Obviously you have pillows at home, but relative to the wedges and bolsters, all available online relatively inexpensively, 10, 20 bucks. So they may be worth the investment for you. Although one of those I'm certain that you don't have at home is one of these, which is called a Mackenzie roll. Big fan of these. So I'll show you how this works. Particularly, we'll start with the face-up positioning here. The Mackenzie roll is meant to be kind of tied around your waist before you hop into bed. So it's got these little straps on it here, so we'll tie this in. And now when Madison lays face up on the table, she gets in bed. This Mackenzie roll will help support the nice curvature in her lower back. Again, the goal here is getting as close to anatomically neutral as we possibly can. One of the things that I hear almost unanimously from patients about laying on their back is that laying with straight legs will increase back pain. And there is underlying physiological reasons for this. So the best thing to do when laying on your back that I've seen is to keep your pillows, or keep your knees nice and bent. And we can do that just using regular household pillows. So we'll throw a couple of those up underneath the knees. Or another thing that you could do if you wanted to throw some extra money at it, they do make these bolsters here that are shaped specifically for elevating your knees. So this is a very nice positioning right here for sleeping. Takes a lot of tension off the lower back, supports the lumbar curvature. Certainly a good possibility for a good night's rest here. The next position we're going to do is side lying. With side lying, actually, we're going to keep the Mackenzie bolster in place, and Madison's just going to go ahead and roll over to her side. Now again, with the Mackenzie bolster here on her side, you'll see that it helps to keep her spine nice and straight while she's sleeping. So if she didn't have the bolster here, because of the differential between her hips and her waist, her lower back would sag down towards the table, potentially causing her more pain. So the Mackenzie roll is really great for side lying as well. If you're having leg pain in addition to back pain, try laying on your left, try laying on your right. Perhaps one side more than the other will offer you relief. Another thing, again, almost unanimously that we hear is that patients laying in the side lying posture, having their knees stacked like this will invariably create more pain for them. Specifically also laying with the knees kind of scissored definitely causes more pain because it adds some rotation into your pelvis. What we find that works best is keeping the knees stacked one on top of each other, and then putting at least one pillow between the knees, maybe even two, just to separate those out as well. Again, they do make a fancier pillow for this that you can get on Amazon, and this is meant to be worn here and just kind of hold the knees in position through the night. One other tip that I have for side sleeping is if you're having that sciatica, that leg pain associated with your back pain, let's assume for Madison that her left leg is the one that's bothering her. So Madison's going to roll over And you're going to put your affected leg up in the air. So for her, her left leg is the one that's producing the pain. She's got her Mackenzie roll. She's got her pillow in between her knees. One other thing to try if you're looking to get more relief from the leg pain is you could stack a pillow up underneath your ankles here. That should give you a decent sense of relief. If one's not getting it done, you could even try a second set of pillows. It adds just a little bit of external rotation to the leg, takes some pressure off the sciatic nerve. So that's a really great tip right there to getting some relief as well. The one thing that I like to say is that stomach sleeping is not advisable. Again, most patients will tell us that with stomach sleeping, they tend to have a lot of back pain. So I would tell you to avoid that. And the last thing I would show you guys, one of my favorite pillows to have, and this is for general use, not just if you're in back pain, are these reading wedges. So you can use these when you're laying up in bed. Maybe you're on your phone or you're reading a book, watching some TV. We keep a couple of these around the house, and they're just, even when you're not in back pain, these can be really nice. Again, very affordable on the internet. Go ahead and get yourself one. So hopefully you found this video interesting and useful. Hopefully we've given you some tips and tricks that can help you get a better night's rest. If you have any questions or concerns, don't hesitate to bring them to me at your next appointment, or you can even just shoot me an email, ask me any questions that you guys want. We'll do everything we can to get back to you as we work to help you guys get back to health. Have a great day and a great night.